Hello, my name is Greg Heath, and I'm a member of the steering committee of the GoPA, and I'm here to talk about the importance of physical activity promotion. Yes, well, that's a great question. Yes, there are a significant number of physical activity intervention strategies that have been shown to be effective. These have been classified under domains of health promotion or community-wide campaigns, for example, and informational approaches, social and behavioral approaches, as well as policy environmental approaches. The observatory can be helpful in promoting these by identifying, or in the country cards, for example, contact people within each country who are knowledgeable about these particular intervention strategies. There will also, perhaps in the future, there will be links to various key resources that will talk about interventions that actually work in communities. And perhaps also the other benefit is that as one can look at not only their own country, they can look at other countries and identify other resources that might be applicable and effective in their own settings as well. Although physical activity promotion has been targeted to individual behavior changes and enhancing motivation to be physically active, both in terms of behavioral and social approaches, and also through physical activity-friendly environments, despite that, physical activity across the globe is still pandemic. That is, physical inactivity is still at pandemic proportions. The built environment in particular, and particularly the built environment that supports active transportation, such as pedestrian or walking and bicycling, provides an opportunity to build into the daily lifestyle of people physical activity. It also affords the opportunity for people to have access to facilities that can be approached and again accessed by physical activity itself. So parks and recreational sites that have trails and bikeways to them. Essentially creating opportunities for being physically active that are relatively easy choices as opposed to difficult choices. The observatory has a unique role because of the country-specific information, so that even though it has a lot of information about the level of physical activity, that can be used to support the evaluation of subsequent interventions as they're rolling out. The other role is raising the awareness of policymakers and decision makers in communities that physical activity is an important health behavior and one that has significant public health implications and applications. In medicine, we often refer to the translation of evidence from bench to bedside. In the public health promotion of physical activity, we refer to that as the translation of evidence from the bench setting to the community setting.